from an overall health perspective, definitely from a cancer prevention perspective, balancing blood sugar is key, because we know that cancer cells like to grow when blood sugar is high or insulin is high.
Coming up on today's show, we have Dr. Elizabth Boham talking about breast wellness, how to heal and prevent breast cancer. Right now, breast cancer and other estrogen-related carcinomas are on the rise. Every 2 minutes, a woman is diagnosed, and every 1 in 8 females will be diagnosed in their lifetime. There has also been an increase in younger women getting breast cancer. Currently, 260,000 women in their 30s and 20s have it. If we have the most advanced medical technology in the world, why is breast cancer continuing to increase and at an even younger age in the United States? As a breast cancer survivor herself, Dr. Boham explains what she believes to be the cause. You don't want to miss this informative interview. Stay tuned. Hey everyone, I am Fallon Mercedes Brock and welcome to the Fit with Fallon podcast. On this episode, we have a very, very special podcast. It's one of my favorite online TV doctors. Her name is Dr. Elizabth Boham, and she is a breast cancer survivor. Congratulations. It's been 21 years. Is that correct?
21? Yes.
That is amazing. You're also a functional medicine doctor. You are the director of the Ultra Wellness Center in Lenox, Massachusetts, and you're also a registered dietitian. So you are a woman of many trades. How are you doing today?
Oh, I'm doing really well. Thank you for having me, Fallon. It's great to be.
Thank you for joining me via Zoom. I'm actually from Massachusetts. I live in Atlanta, Georgia now, but I'm hoping to move back. Have you ever been to Worcester?
Yes.
Worcester.
That's from?
Yep, so that's my hometown. Is there any snow up there?
We've had some snow, but there's nothing on the ground as of yet. So we've had a little bit of snow flurries here and there, but no accumulation yet.
We here in Atlanta, we don't get much snow, maybe once every, I don't know, a couple of years. And last night there was like some flurries and I was like, yay, I miss snow sometimes, not shoveling it.
No, right? It's fun this time of year. Then you get to February and it's not so much fun.
Yeah. Okay, awesome. So today I really want to talk about breast cancer. You have a DVD out right now, and you also explained to me that you don't need a DVD player to watch it. You can also download it on Vimeo. And you have also a PDF that you can download, an ebook, and it's called Breast Wellness, and it's the healing, I believe, functional healing to cancer. Is that correct?
Yeah. So, as you mentioned, I had breast cancer when I was 30, so a bunch of years ago. And when I got back into, when I was starting to practice again, and I was really interested in, okay, why did this happen to me? And how can I keep my body well? And because I was already always interested in exercise physiology. I was interested in nutrition. I felt like I was practicing what I preached. And I was very shocked. I didn't have a family history of breast cancer. And so, I was young. And so it was very upsetting, as you can imagine, as it is for so many people. Mm-hmm. But I really wanted to figure out, so why did this happen to me? And how can I prevent it from happening again? Mm-hmm. And then how can I help prevent it I ended up having children for my daughter and for all my patients. And I started to learn about functional medicine. And functional medicine is really a great different way to think about the body and how all the different systems in the body are interrelated. Mm-hmm. And in functional medicine, we really focus on that individual person and recognize that we're all individuals. And so, if you had 10 people with breast cancer, for example, or any illness, you could have 10 different reasons for why that happened, or even hundreds of reasons, right? And so it's very important that we step back and look at each individual's story and what their individual risk factors are and where they need to focus to help their body get well and heal. And so that was just sort of this way of learning about medicine that was transformational for me.
I bet.
Because, it was like a whole different way of thinking about health in the body. And then it was really important for me individually as well. So it was great with my patients, and I was learning so much about how better to take care of my patients, but it also really taught me how to help myself because I was so focused on nutrition and exercise, which I think, of course, I love and they're so important. But for me, I also had to focus on how I dealt with stress. And I had to focus on how my body detoxified or didn't detoxify, and my digestive system, which needed a lot of work. And so that's really what I wanted to get across when I did the breast wellness DVD, and really just to talk about all those things we think about when we're looking at how to improve somebody's risk of getting, decreasing the risk of breast cancer, help their body heal if they do have breast cancer, or just really just wellness in general. And it really just sort of goes through that whole functional medicine approach where we're looking at all the systems in the body, lifestyle, of course, but also thinking about how the detox system's working, the digestive system's working. And so, when less and less people have DVD players now, so it's also on Vimeo, as you mentioned. And if you go to my website, you can just download a free ebook as well with some of the information in it.
Now, with your breast cancer, you were 30 years old. Now, when most people think of breast cancer, they think of older. And I know you guys listening, if you followed my journey, I'm in my 30s. I also had a precursor for uterine cancer, which my biopsy came back and it came back negative. So I'm super excited. And I followed some of the steps that you had, but even I was shocked. Like, I'm only in my 30s. Why is cancer happening now at a younger and younger age? Why do you think?
I mean, probably the biggest difference is our toxic load, right? I mean, we're exposed to so many more toxins than we were, a few generations ago. There's been this explosion of chemicals and pesticides and toxins into our environment, plastics that we now know influence so much of our health. And there's a lot of things in the environment called xenoestrogens. And what that means is they're chemicals from the environment, but they can act on the estrogen receptor in the body. And so one of the ones we know so much about, right, is BPA, that hard plastic. Yes, and receipts and, hard bottles. And so, we know that BPA is not good for us. We've seen that it can actually impact the estrogen receptor in the body. And if somebody has precancerous cells, or if they, can cause things to grow, it's almost like acting like estrogen in the body, even though it's this chemical from the environment. And so, but we're learning there's lots of other ones too, right? So there's pesticides that can act like that too. And so it's important that we recognize that this toxic load, I think, is really influencing our health, our fertility, our hormone balance, not just in women and men, so it is something we want to really work on, lowering not only our exposure, but also how the body can get rid of whatever toxins we get exposed to.
You mentioned hormones, and I have been noticing even some of the girls in my family, I'm also a health coach, some of the girls that I coach, they're getting their menstrual cycles earlier and earlier, and it's really like mind-blowing. I've had clients as young as 8 years old start their menstrual cycle. Why do you think that is? And does that increase their risk, being exposed to so much estrogen at a young age? Does that increase their risk to getting breast cancer and other estrogen-like cancers?
Absolutely, right? So we do know that our estrogen exposure over our lifetime impacts our risk, especially for breast and uterine cancer. So yes, that when we start having our period younger, or if we have our period later on in life, if we don't get pregnant, they think because during pregnancy there's a break in our cycles, and maybe that's why. There's probably other reasons too, but yes, absolutely, estrogen exposure during our lifetime impacts our overall risk. And so I think that the biggest reason also for that is this toxic load, is these xenoestrogens in the environment. I mean, we don't really have it all figured out. Yeah. A lot of people have blamed it on weight and weight gain at a younger age. Yeah. But we also have to recognize that these xenoestrogens have been shown to increase risk of weight gain, right? So like BPA has been associated with insulin resistance and weight gain. so it's all connected, right?
And that makes sense because I've been getting a lot of younger clients who have insulin resistance or diabetes. And typically diabetes was thought as onset, adult diabetes. And now children are starting to get it, and even like preteens. So that makes sense of what you're saying. How do you feel about, there's been some association with dairy linked to higher estrogen levels and girls getting their periods earlier and even different types of cancers?
Yeah, so dairy is really interesting. Cow's dairy is really interesting, or animal, even goat's dairy probably. So for those animals to produce milk, they have a lot of hormones floating around, right? They've been induced into having high levels of hormones that then, of course, gets into the milk supply that we drink. Now, organic is better, of course, but it doesn't eliminate all of those hormones, and some of us are more sensitive to those hormones than others. So there has been, shown to be this association for with dairy and some of these hormone-related cancers.
Yeah, I was watching a documentary and I didn't know, you just mentioned they are induced. So over a typical female cow's lifetime, she is constantly being, I guess, IVF type of pregnancy to be constantly pregnant. So I was just imagining, like, as a woman, to be after every baby, to keep on having more babies, how much hormones must be in your system, and then going into your milk, and then if you're consuming that milk. So do you suggest your patients who have high estrogen or get their menstrual cycles early or carry cancer genes, do you typically tell them to stay away from dairy?
Yeah, I mean, we're typically, dairy is one of those foods that I eliminate from a lot of people's diets, both from the standpoint of hormones and the high level of hormones in it. In addition, a lot of people react to dairy, with those hormones in dairy, and can cause a lot of acne for people.
Yep.
A lot of people have a hard time digesting it. So for a lot of people, we either cut it out totally or cut way back.
Got it. How do you feel about like meat? Do you suggest people to take out meat completely, or is it okay if it's organic? Because I know I was explaining to you, I read the China study and there was a big correlation between animal protein and cancer. So what are your thoughts on it and what do you suggest?
Yeah, so T. Colin Campbell is actually one of my professors at Cornell.
Oh, that's so cool. I love him.
I remember him telling us stories about dairy, like he wouldn't have his kids in preschool or at childcare consume dairy, and they got very upset with him. So he would tell us stories. So I appreciate his research. The biggest concern I have with eliminating all animal protein is a lot of times when people eliminate all animal protein, if they don't do it correctly, we start to see a couple of things that happen. And everybody's different and everybody's body is different. But the two things we sometimes see is, one, we can over time start to see some nutritional deficiencies. So we have to really watch for B12. We have to watch for zinc. We have to watch for those omega-3 fats. We have to watch for iron, so that can happen, over vitamin A, so over time that can happen for some people, especially depending on how they're doing it. And a lot of people, when they go vegan or vegetarian, many times they're, they don't always, they end up eating way too many refined and processed carbs. I mean,
and I think that's why so many people that I've met since going vegan, they'll classify themselves as plant-based. And I think that's really important that you're saying that, because my husband and I both went vegan, and he'll go to Burger King and have an Impossible Whopper with fries and a drink, and he's technically vegan. Right. And I appreciate him for coming on this vegan journey. But, I explained to him,
that's not a healthy food.
Exactly. They're still frying that Impossible Burger, and it's still it's processed. So yeah, I think you're so right. You need to get your
really critical. So a lot of patients we work with, I mean, the biggest thing we work on is increasing plant foods, right? So you want to get all of those vegetables and good healthy plant foods, those phytonutrients coming from your vegetables and fruits and spices and teas, that's really important. We think we want 8 to 12 servings of those phytonutrients every day coming from your plant foods. And so that's a key. And then we work on making sure that people are getting healthy fat and healthy protein at every meal, balancing their blood sugar and eating whole foods and not eating processed foods, right? I mean, I think one big issue, right, when somebody is vegan, they go out to eat, not that we're going out to eat very much these days, but if you go out to eat, really, a lot of times, most restaurants do a really awful job. The option is pasta, really, right? I mean, so there's not, you can go to better restaurants, of course, but that is a big problem. And then, so in terms of protein content, I love vegetable proteins. Like I love beans and legumes, nuts and seeds. I love them. But a lot of times I have people balance them with a little bit of good, clean animal protein, wild caught fish, organically grass-fed beef periodically, but not the high levels that most Americans are eating.
Yeah.
But Mark Hyman always likes to say, as a condom meat, right? Like a small serving of animal protein can really go a long way and help people with all of those other issues we see over time. So it really depends on the person.
So if you have somebody who's vegan meat, what would you say, or what would you suggest? Are there supplements that you would say are a must if I'm not eating animal protein at all?
Yeah, I mean, the biggest things will make sure that somebody's getting enough omega-3s or give them an omega-3 supplement. Okay. There are vegan-based omega-3 supplements. And then some vegans will say, okay, I'll take some fish oil or I'll take some small fish periodically, like sardines, which would be a great way to get some omega-3s in, which have a lot of anti-inflammatory properties and are good for the skin and hair. And then we think about B12 and zinc, and not everybody, it depends on their diet. They don't not everybody, and how they absorb. Not everybody needs to take them, but
I just started a methylated B12 because I've heard you talk and so many doctors saying some people don't, they're not able to, like, I guess, take it all in.
Yeah. So, good quality B vitamins often, especially folate, good quality, if you're getting it from a supplement, you want it to be a methylated form of folate. It's better used and absorbed in the body. And same thing with some people for B12. That methylation is just this activation, think of it in a way, of the supplement that helps it be more utilized in the body. And so,
because a lot of the folate, like in a multivitamin, if you read it, sometimes it will say folic acid, and that's different, correct? And I believe that could even cause some health issues if you're not getting the right type. Is that correct?
Absolutely. So folic acid is the synthetic form of folate, and folate is a B vitamin, and it comes from our foliage, and that's why we call it, folate.
Oh, I didn't know that.
Yeah, so like your green leafy veggies, but it's in lots of plant foods. So, your spinach, of course, and all your greens, but even in peppers and oranges. I mean, it's in lots and lots of plant foods. So, but folate is really important for energy and healing damaged cells. And there's so many aspects that folate's involved in. So one of the things that people know about folate is it also has been associated with prevention of neural tube defects. And so that's really one of the biggest reasons women start prenatal vitamins before they get pregnant.
That makes sense now.
Right.
So they don't get spinal bifida, the babies, correct?
Spinal, yeah, exactly. So that's why prenatal vitamins have 1,000 micrograms of folate in them. So there's lots of, you get a lot of folate from your food, but from a supplement source, it can either be in the form of folic acid, or it can be in the form of like a methylfolate, which is more activated. So there's been some concerns about folic acid, which is the synthetic form, for a couple reasons. One, the body can't always utilize it depending on your genetic makeup. There's this gene called the Mthfr gene. And if you have a variation in it, some people can't take their folic acid from that synthetic form and utilize it in their body. And there has been some concern that for some people that it might build up in tissues and may actually be associated with increased risk of cancer. There's been this big question. But if it's a methylated form of folate, we feel better, and we feel like that can then the body, even if you have this genetic variation, can utilize it better. And most of the folate in our food is already methylated. Like it's not in that form, that synthetic form, which is the concern. That's one of the other reasons that processed food, there's such a concern with processed food, because a lot of times they'll spray on the synthetic folic acid.
Okay, that makes sense. So would you suggest whenever we're taking supplements to just take a methylated form if there's a methylated version of it?
Definitely for folate. Absolutely. Yep. And more of the high quality supplements contain that methylfolate and not the folic acid. And I think that's a better way to go in general when you're getting like a B complex or a multivitamin or in somebody's prenatal. You want that methylated form. With B12, it's a little bit different. I often will make the decision based on somebody's genetics. And if it's not possible, either form is probably fine. Some people with high doses of B12, it depends on how much somebody's taking. If they're taking really high doses, it might make some people a little more anxious. So we might have to play around with the kind. But in general, a methylated form is good for a lot of people.
I was recently researching, and I even heard there's even some studies saying that the timing that you take certain supplements could impact how your body uses them and absorbs them. Is that true?
I mean, circadian rhythm is so interesting. And we know that our body has a rhythm that's based on time of day and how well it works. So there's so many fascinating things I think we're going to learn in that area. But a lot of times with B vitamins, most people, we have them take it in the morning, and because it can be a little stimulating for some people in the afternoon or evening. So in general, people will take their multi or B complex in the morning. It doesn't bother everybody, but
is there any supplement that you suggest taking at night that will help, help you, I guess, absorb it?
Yeah, so at night, a lot of times we'll give people things like magnesium, or if they need
calming
extra calcium, calming things, especially magnesium. That's like my favorite nighttime supplement.
That's actually one of my favorite supplements, just because I have struggled with constipation for so long. And once I started taking magnesium, it really, really helped me out. But magnesium, it can help for so many different things. Why do you think so many people are magnesium deficient, that they're not getting enough magnesium?
Yeah, that's a great question, because magnesium is in so much of our food, right? It's in lots of our vegetables, and it's in our beans and legumes and whole grains, and it's in nuts and seeds. So there's a lot of foods, lentils that are really high in magnesium. But probably the biggest reason that Americans are deficient in magnesium is because of processing of food. So when you take, for example, brown rice and make it white rice, right? 95% plus of the magnesium is removed from that rice.
Wow.
And that's not like, so when they take the hull off of the brown rice and they make it white rice, they spray back on a bunch of the B vitamins, but they're
processed. They're not real vitamins.
Don't do that with the magnesium. And so one of the biggest reasons is processing. So whenever a food is processed, when you refine a grain, you're going to pull off all of that good magnesium. So the more white bread or really bread in general, because most of it has a lot of processed flour in it, and any refined processed grains, all of that is going to be naturally magnesium deficient. And if you spend your calories on that, then you're not going to be eating your beans and legumes, right? For example, or enough nuts and seeds where you'll get your magnesium. The other reason is, unfortunately, our soil is becoming a little more magnesium depleted because of farming practices. So we're seeing some deficiencies there. And we know that the body uses up magnesium with stress. So when we're under chronic stress, our body needs a lot of that magnesium, so it uses it up. And so that's another real reason that we start to see deficiencies for people.
Makes sense. I remember you put a post up talking about DIM and me having, estrogen dominance and all this other stuff going on. You put in the comment to take DIM with I3C. Can you tell us what is DIM and how it can help if you have a lot of estrogen in your system, and how even I3C can help lower, I guess, part of your risk of getting certain types of cancers like breast cancer?
Yeah, so DIM comes from our cruciferous vegetables, right? So that's like your broccoli, cauliflower, cabbage, kale, Brussels sprouts. They naturally have these components in it that help the body with estrogen metabolism.
Mm-hmm.
So as a supplement, it can be a real powerful tool whenever somebody has like an estrogen dominant type of a situation. Mm-hmm. So we see that with, breast and uterine cancers, so estrogen-related cancers, but also PMS, fibroids,
PCOS.
Yep.
Endometriosis,
exactly. So what this supplement can do is help with the metabolism of your estrogen and help break it down in a healthier way. And so there's a lot of things when somebody has estrogen dominance that we pay attention to, right? We think about, well, what can we do to lower the estrogen that the body is producing? And then how do we help the people metabolize it once they've made it? And how do we help people eliminate it out of their digestive system, right? So one of the things in terms of production of estrogen, we know that when we maintain a lower percentage of body fat, that really does help with the amount of estrogen our body produces. So our body fat has this enzyme in it called aromatase.
Mm-hmm.
Yep, exactly. So when we have more percentage of body fat, then we have more aromatase, and then we make more estrogen. That aromatase actually converts other hormones like our testosterone and our DHEA. This happens in men too, unfortunately, but it converts those hormones into estrogens. Mm-hmm. So when we lower our percentage of body fat, when we increase our lean muscle mass, and we lower the amount of body fat we have, we can actually lower the amount of estrogen that's produced in our body, which is a great first step, right? And then we want to work on metabolism of the estrogen. And that's where DIM and I3C comes in. And that just helps with metabolism and the breakdown in a healthier way of the estrogen. And then we also want to make sure we're having regular bowel movements, and we're eating a lot of fiber, and we have the right microbiome, right? Because that helps with the elimination of the estrogen after it's done its job in the body.
Yeah. Let's talk about fiber. Most people always worry about your protein, like how much protein are you getting? You're not getting enough, but not enough people talk about fiber. And I feel like that is so important. And I know in your PDF, the free one that you could download, if you go to your website, in it, you outlined as fiber being one of the important things to have a healthy terrain. So tell me, why is fiber so important, and why are we as Americans just not getting enough of it?
Yeah, fiber. It is our friend. It's my favorite thing to talk about. So, fiber is great because it does a bunch of things. One of the things that fiber does, so fiber is the undigestible parts of the food that you're eating, right? And it's because of that, so if you eat something that's rich in fiber, like ground flaxseed, mm-hmm. you're not going to absorb all of that. You'll absorb parts of it, but then the fibrous parts will go into the colon and feed all of your good bacteria. So fiber is the part of the food that is actually food for the good bacteria in your colon. Mm-hmm. And as we know, we're learning so much about how important these good bacteria are in our digestive system, because they can influence our metabolism, they can influence our weight, they can influence whether or not we have insulin resistance, mm-hmm. they can influence whether or not we get cancer, and as we were talking about, how we get rid of our hormones, right? So the other really important part about fiber mm-hmm. is that it helps to balance the blood sugar. And so from an overall health perspective, definitely from a cancer prevention perspective, balancing blood sugar is key, because we know that cancer cells like to grow when blood sugar is high or insulin is high, right? So when you eat a meal that's, let's say, like pancakes, orange juice, and syrup, right? That's
the typical American breakfast.
Very refined and processed. It gets absorbed really quickly. There's not a ton of fiber in it. Your blood sugar goes up and your insulin goes up. And then that blood sugar and insulin are both food for cancer cells. They also cause us to gain weight around the belly and feel tired and crash a few hours later and all those things. So when you shift that breakfast meal and have something that's richer in fiber, that's really going to be helpful in terms of balancing your blood sugar. So great sources of fiber would include, like the ground flaxseed I was talking about. Nuts and seeds are a great source of fiber. Beans and legumes, all your vegetables are a really good source of fiber as well. So that's really important. You want to think at every meal, do I have a good source of fiber here, really to help with slowing my increase in blood sugar?
Got it. Love it. Yeah, I try to eat fiber every day. I actually even blend up my flax seeds so that they're more open. So I feel like I can give them to my microbiome good bacteria. They'll be broken up for them if they can eat them better.
Yeah, blending it is great. I buy my flax seeds whole, but then keep them in the freezer. And then I grind them up in a coffee grinder every couple weeks. And I keep the ground ones in my fridge because it's ground flaxseed that's ground up like that is a very delicate fat, so it can oxidize and go rancid kind of quickly. So you want to keep it cold.
I didn't know that.
Kind of quickly because it can go old.
Okay.
So grind it up, keep it in the fridge for a couple weeks at a time. And then, but yes, grinding it really does help, get all the omega-3s from it and really great in terms of a fiber source.
Okay. I'm going to have to add that. I got to put it in the refrigerator because it's not in the refrigerator right now.
Yeah.
I want to talk more about your story and how you found out you had cancer, because even in my situation, everything was pretty normal except my PMS, and I wasn't getting pregnant. So those were the only triggers for me that really kind of put a light bulb that went off. So you were in your 30s as well when you found out, but were there any symptoms, or was it just a routine checkup? Or, because I know you also mentioned, this type of cancer didn't run in your family, so it's not like you were getting screened. So how did you find out?
Yeah. So I was 30 at the time. And, we were also I was married, we were about to start a family. So we weren't getting pregnant either, but we hadn't tried for very long.
Yeah.
I was in the middle of my medical residency. And so I had just worked with a breast surgeon. So in residency for medical school, you kind of go around and work with different specialists. So I had
find out what field you want to end up going into.
Just to learn too, right? Yeah. Like you work with a gastroenterologist for a while, and then you work in the ICU for a while. So I had worked with a breast surgeon, and so I was actually doing breast exams on myself, not because I was worried I was going to get breast cancer. Like it was never something I thought I was going to have. But because I wanted to learn how to do breast exams on my patients. Mm-hmm. Yeah. So I was like, okay, I want to figure out how to do a better job at doing the breast exam. So I would be like, okay, once a month, I'm going to do my own breast exam. Mm-hmm. And so we, 1 month, it seemed normal to me. My breast exam seemed totally normal. And then the following month I had this mass in my breast. So,
was it small? Was it little? Or was it big?
It ended up being 1.7 centimeters. So it was bigger than it should have been.
Yeah. Wow.
And I had a triple negative breast cancer, which is a very fast growing breast cancer.
Wow.
So it's possible. I mean, I couldn't feel it the month before. So whether I just was not very good at doing my breast exam, or probably not. Probably it was just a really fast growing cancer.
Wow.
And then, I was like, what's this? And and like a typical doctor, I was like, oh, it's nothing. My husband's like, yeah, you should probably get that checked out.
Oh, mhm. But
And
wow, the timing, like, thank God you were in that part of your training,
I know.
because had you not found it at that moment, it could have been even more aggressive by the time you found it.
I was so lucky
Wow.
because I was, for so many reasons, like you said, most 30-year-olds are not doing breast exams. And I also, I just worked with this breast surgeon who ended up being my breast surgeon. And
Perfect.
so once I found it, and I was in residency, so I was in the system very quickly,
Yeah.
which for the type of cancer I had was a life and death situation. Like a lot of breast cancers aren't that fast growing, but this type was. So I was very, very, very lucky with the whole timing of things.
So when should women start checking their breasts?
Yeah, it's a great question. And in terms of like the general recommendations by the American Academy of Family Practice and the US Preventive Task Force, there's a lot of disagreement about this. And we used to always teach women how to do their own breast exam.
Yeah.
And we've kind of stopped making those recommendations because, they look at the risk and benefit always. So, but what I do tell women is that you really just want to get to know your own body. And that's really important. And
Love that. Yeah.
and so, look in the mirror if things look different, or if you feel something that feels different. And with men, we tell them the same thing with like testicular exam or whatever. That happens with young men unfortunately, very frequently.
Yeah.
Is you get to know your own body. And if something feels different or looks different, definitely get in with your own doctor and have them check it out.
Yeah.
It's probably, most of the time it's going to be nothing, but some of the times it is. The other thing I did notice is I was tired. I run. And so I was having a harder time completing my runs right before the surgery. But I was also working nights because I was working in the ICU.
You're like working all these crazy hours.
It's just because of my training. But I was amazed when after surgery, how much better my energy was. It was
Wow.
once they removed the cancer. So it was making an influence on my energy level as well.
You bring up energy, and that makes me think of the thyroid and how that can impact, your energy levels, but the thyroid is a hormone. So does that hormone affect estrogen-like cancers as well?
It's interesting that, all of our hormones are interrelated.
Mm-hmm.
So definitely our estrogen, progesterone, thyroid, adrenal, they're all connected in a very interesting way. And we do know that when women, for example, are under a lot of stress, that can influence their thyroid and their adrenals and their hormone and their female hormones. So they all do kind of have an interrelationship.
Mm-hmm.
But I don't always think of thyroid directly impacting our female hormones. But in a way they do. Like if somebody is low thyroid, they often stop getting their period. Or that's something we check all the time when a woman is struggling with getting pregnant. We make sure that their thyroid is working really well, because that can influence fertility significantly.
Yeah, makes sense. Now, talking about stress, you mentioned in your book and in your PDF, I mean, not your book, your PDF and your DVD, that you did Reiki and yoga to kind of help with the healing process from the cancer. So why do you think Reiki worked for you, and how did you sometimes I see doctors who are trained a certain way, they kind of stick to the basics. What made you go out and try something so unconventional like Reiki, which is, I believe, a Chinese medicine technique?
Yeah, so that's a great question. I was always interested in other modalities of healing, so it was something that always personally interested me.
Mm-hmm.
I didn't really realize that I was going to have to just put it into practice at such a young age. but it was something that always fascinated me. And my mom had done some work with a Reiki practitioner and had gone through sort of the initial training in how to be a Reiki provider. And Reiki really is an energy medicine where hands are placed on. I mean, you can also do it remotely when people are not in touch, with hands on. You can send good energy to somebody through Reiki, but it's a way of shifting energy in the body. And so my mom gifted me, actually, after I had this surgery and I was starting my chemotherapy treatment and everything, she gifted me with a weekly session with this wonderful Reiki provider, Carol Lovely. I mean, she changed my life. I will always say that, I would go in weekly, and, I would just lay there and she would do hands-on work. And, I can't even understand sometimes how it changed me. It was one of those procedures or practices that really helped some of the fear go away, and really helped me sort of have less fear with something being so wrong in my body, and was this going to happen again? And it also really helped with me energetically, and just all of the side effects of the chemo and the radiation. So it helped in a lot of ways. And then probably, deeper, that I can't even.
Yeah. When I lived in California, I lived in LA for over 8 years. They're very open, and there's tons of acupuncturists and Reiki healers. And that was the first time that I got exposed to that type of, different type of healing and medicine. And I remember when I first found out about my precursor, I had called my old acupuncturist and Reiki healer. And the first thing he said to me was that a lot of women who get like uterine or ovarian type of cancers, like female cancers, sometimes it could be due to like relationship stress or issues. And I found that really interesting. And I'm like, wow, I was in a really bad relationship for many, many years. Maybe that was the problem. But their way of thinking and connecting things, just, even like, I'm sure you've heard of chi, and that's the energy that you have. And then even when you were talking about the circadian rhythm, they believe at different times of the night, that's when a different organ is healing. So if you wake up at 2 a.m., that means your liver is off. Or if your tongue, if there's certain marks on your tongue, that means your chi is off. But yeah, it was just really interesting. Is there any things that you learned from them that you carry into your practice as a functional medicine doctor?
So, I think that just recognizing that the body has this tremendous ability to heal, right? And it knows how to heal, and that we want to put it we want to allow it to heal. So that means we want to take away things that may be preventing it from healing, whether that's a stress or an infection or a toxin or an unhealthy food. And we want to support it with things that just help it heal, right? And that's where I think a lot of these complementary type treatments can be so helpful. Acupuncture was also very helpful for me. And it helps, I think it helps a lot of my patients with hormones and hormone balance. I use, food, and we use supplements, and we do testing, we look at all these, but I think a lot of times acupuncture can really be beneficial with those patients to just help people with their balancing of their hormones. So I will often, refer people to different practitioners that I know that are just so powerful. They're just good healers, and that really makes a big difference. With helping people get their body into a position where it can heal.
Yeah, and I think that goes along with what you practice with the functional healing. It's taking everything, it's not just the physical, it's not just like the cellular level, what's going on, but the spiritual, the emotional aspects of it. So I love that. So I do have a couple more questions for you. In terms of, I guess, breast cancer and it being genetic, how much of cancer in general and breast cancer is genetically attributed? Like, how many women carry a BRCA gene, or is there a uterine gene or a colon cancer gene? Should everybody be going out and getting tested for this gene, or only if it runs in your family?
So that's a really good question. So there are I like to divide it into high impact genes and low impact genes, right? So high impact genes are genes that they're not very common at all. They're not I have to look up the exact percentage, but they're not very common in terms of like BRCA. The BRCA is a good example of it, but it's got a huge impact in somebody's risk for cancer, but it's it's not very common. I mean, it occurs, but it's not very common, right? Many times when you're trying to determine if somebody should get BRCA testing, you're typically looking at, do they have a lot of younger women in their family with breast or ovarian cancer?
Like if your mom passed away from breast cancer, you definitely want to get tested.
Yeah, and a lot of times they check the person who has the cancer first. So if that person is still alive and they had a cancer at a young age, they will get tested. I was tested. I was negative.
That makes sense, because I did genetic counseling, and they were telling me that I shouldn't get tested for uterine cancer, but they said some of my aunts should be tested because they had thyroid cancer, even though it's not uterine. But I just found that interesting, and I'm like, why don't you just test me? And they said, well, yeah, they have it. They need to be tested if they carry it.
Right. And then if they're positive, that might impact if you get tested.
Yeah.
So, working with a genetic counselor can be really helpful. So that's a high impact gene. So BRCA is a gene that influences how the body is able to heal after our DNA has been damaged. But some people who have a variation in that gene can't heal from DNA damage as easily. And that then increases their risk of breast cancer and ovarian cancer substantially. Then there are a whole subset of genes called low impact genes, but they're high frequency. And they're genetic variations called SNPs, single nucleotide polymorphisms. They're just sort of variations in our genetic.
So intelligent. Do you teach? You're amazing.
There are these slight variations in our genetic material that influence our risk of diseases, but not like BRCA, which has a huge impact on our risk, but is not very frequent. These are very frequent, but have a low impact risk. That gene we were talking about earlier that has to do with methylation, the Mthfr, that is a good example of a low impact gene that lots of people have a variation in. I can't give you the exact numbers off the top of my head, but huge percentage of people have at least one variation within that gene. And then 20 to 30%, or making that number up, but have a maybe homozygous variant, meaning they get one from their mom and dad. So there's a lot of people who have that genetic variation, but it has an impact, but it's not like, oh, you have this, you're gonna get this disease. But what we're learning about those genetic variations is that does influence what we need from our food supply, maybe what we need from supplements, because and why certain people feel better if they figure some of those things out. So some people need a lot more DIM or sulforaphane to help their body metabolize their estrogen, and they can get it from food if they're eating cruciferous vegetables every day, but not everybody's eating that every day, and so maybe they would do better with a supplement or more methylfolate. So that's where we can really look at if we can evaluate people's slight variations or these SNPs in their genetic material that have a low impact on risk, but we can really impact their life and how they feel and their symptoms when we evaluate that, and then make modifications in their diet or supplements with that being the case.
Got it. So what I'm hearing is that, okay, say if you don't have like a, first generation family member who has a certain type of cancer, maybe you should go and get tested, maybe not so much for being a carrier of the cancer, but maybe for nutritional deficiencies or lack of having these genes that you can, methylate and break down some of the nutrients.
That can make a big difference. That's a lot of where we work, and it can really make a big difference, not only in how somebody feels, but their disease progress or process in their body. And then, of course, if you do have a strong family history of younger people getting a certain type of cancer, you want to talk to your doctor and determine if looking for some of those high impact genes makes sense for you.
Makes sense. Okay, so say if you do have high impact genes, or say you carry certain precursors. So I know for me, they were saying, after you have kids, you may want to get rid of your uterus. Or say if, I know Angelina Jolie, she didn't have the cancer, but she had BRCA, and then she went off and decided to get her breasts removed. So do you feel that that's like a necessary step, or if you are getting testing done in terms of making sure you can break down certain foods and you're eating good and exercising, less stress, do you feel like going to that extreme is necessary?
That's such a good question. I think that information is power here. So if you do find out that you have one of like a BRCA variation or one of these high impact genes, then, you want to work with your doctor to figure out how much that surgery or screening modality will lower your risk. And so those kind of conversations, they're very personal and individual, and you really want to work with your doctor on that to determine what's the best course of action for you. The good news, I was just saying this to a patient the other day, the good news, if you find out you have BRCA, is that you found out, right? And so that means that we have such great screening modalities today, and we can really watch people very carefully. And so if we can find cancer early, as it's so much, you can treat it really well. And so that's really the goal is we want to prevent cancer, but sometimes it happens and the second best thing is finding it early.
Yeah, makes sense. I keep on thinking about tofu and soy, maybe because I had that for breakfast. And for so long, I was afraid to eat soy. Can you tell me, a lot of people think soy or any tofu will, exacerbate your estrogen levels and, make it worse, especially if you're scared of getting certain types of cancers. Is that true? Do you tell your patients, who have breast cancer to stay away? And is it really the same type of estrogen? I believe it's a phytoestrogen. Is that the same type of estrogen that you have in your body?
No, so actually soy in general decreases risk, and because it lowers estrogen levels. So it's a phytoestrogen. They call it that, which means plant estrogen. They call it that because it can bind to the estrogen receptor. And we know that would stimulate the estrogen receptor, but what we're finding is that it can actually block your own estrogen from binding to the estrogen receptor. And so in a sense, that lowers your total body estrogen level. So soy, and we just have to make a caveat, in its healthy forms, right? So the non-GMO organic soy in as whole food form as possible. So, edamame, tofu, tempeh, these sources of soy have not been associated with an increased risk of breast or uterine or any estrogen-related cancers. And they actually are probably, there was a huge study a few years ago showing an actual decreased risk. And that's true with women who have estrogen receptor positive breast cancer, estrogen receptor negative, whether they were on tamoxifen or not on tamoxifen, there is probably a lower risk. My biggest concern with soy is just the amount of soy in our food supply. And it's a lot of soy we don't really know a lot about. So unfortunately, they're using soybean oils and processed soy. And again, it just comes down to avoiding the processed foods and some cereals, they'll use like a texturized soy protein isolate to increase the protein content. We don't really know about that soy, A lot of times it is genetically modified. We don't have enough research on it. I do have some concerns about high levels of that type of soy, but the whole food soy I love, and I think it's a great part of a healthy diet.
So back to your PDF, you have 5 things, and I wrote them down so I wouldn't forget. Exercise being one, fiber, group support, which I love, sleep, certain like plant nutrients, omega-3s, and green tea to help create a healthy microbiome, which would help decrease your risk of getting certain cancers. Why did you put all of those things, especially like the group support? That was very surprising. And even, just the sleep and the green tea.
So there's been a lot of research showing how community influences our health. And so, many times people do much better in healing when they have a group of people that they're going through a process with. And it can be so supportive and very, often very helpful for our health and healing. They've shown the group support can help with improving your immune system. There's been some research showing that when people are part of healthy, good group support, they actually have more natural killer cell activity, which helps their immune system work well. Sleep is amazing. We know sleep is so important for overall health. It also helps improve natural killer cell activity, which is important for fighting cancer and viruses and infections. It is really important for our weight and our metabolism.
Yeah.
So often when we're sleep deprived, it causes insulin resistance, it causes weight gain. So sleep is really critical for all of us throughout our whole life. We want to be making sure we're giving our body enough time to rest and to sleep. It makes a huge difference in terms of metabolism and overall health and well-being.
Yeah. Good.
Green tea is amazing. Green tea, it has this component in it. One of the phytonutrients, right, those plant nutrients called in green tea is called EGCG, epigallocatechin gallate. And that EGCG has been shown to feed good bacteria in the gut and help with those good bugs to grow and proliferate. It can actually epigenetically increase the tumor suppressor gene, which is this gene that helps decrease risk of cancer. We know green tea has been associated with less angiogenesis, which just means the bringing blood vessels to a tumor to help it grow. So green tea can suppress that. It's a great antioxidant. It's actually been also shown to improve insulin sensitivity and weight. So green tea is phenomenal. And we always say 2 to 4 cups a day. I mean,
Wow.
how much caffeine you can tolerate, that can influence how much you take. And some people, that is also one of those supplements that some people also take as well.
Yeah. I found it interesting when you said group support, it really helps you. And I read the book by, it's called Quantum Healing. But if you know that book, it's by Dr. Oh, actually I have it right here. Deepak Chopra. But yeah, and in the book, it's saying how powerful the mind is in terms of healing. And he gave all these different cases, and some of them were cancer, that those who either had a spiritual practice or group support or just was overall a positive, person, they seem to heal at such a higher rate. And my mother this year, she had a double lung transplant at in Boston at not Brigham and Women's at Mass General. Yep. So they did a phenomenal job, and she's doing so good. But one of the practices that I did was I made sure nobody in the family came in and cried or was very sad and worried or texted her worried, we made sure it was very positive. I wanted, her support to be very uplifting, because I knew from reading that book that, it could really help speed up her recovery and her process. Now, during the pandemic, we are stripped away from our support systems physically. And so many people are going into depression, or, it's a very lonely time, especially Thanksgiving just passed, and, we're not allowed to have a lot of people over. So have you seen in your practice, certain cases of illnesses or diseases increase? And do you think it's attributed to the lack of group support?
Absolutely. Absolutely. It is a very difficult time for so many people. I'd say most people, but some people are not as impacted by it for whatever reason. But lots and lots of my patients are really struggling. And it's important for us all just to continue to reach out to friends and family in a safe, healthy way whenever possible. And as often as we can, and to also really focus on our self-care and, just making sure we're getting outside and we're moving and we're eating the right foods and we're practicing some relaxation and meditation and getting good sleep and rest. I mean, it's such an important time to focus on that because it's easy to spiral, and when there's all this anxiety going around and lack of that social support and some of the ways that we used to blow off steam and handle stress. And so we really need to all be focusing on that. That's
my last question for you. What is Dr. Boehm's daily routine? So when you wake up, are you drinking coffee or green tea? What are you having for breakfast? Are you working out before you head to the clinic and see patients? In terms of are you putting on regular deodorant, or do you, use certain type of products that have less, chemicals in it? I want to know what's your routine to help prevent cancer. What do you do daily?
Yeah. So first of all, I make sure I try to get enough sleep. I mean, for me, that's really important. And before I go to sleep, I do some sort of relaxation or meditation. I've been trying some heart math lately, which has been really fun. It's a way heart math. It's a way to, it looks at heart rate variability to see how much your parasympathetic nervous system is engaged. It's you can do some meditation with that. And so from the end of the day, that's so important for me. I do work out in the morning. That's I sort of got in that routine when I had kids. My kids are now 19 and 17. So
nice.
I do now have more flexibility, but I got in the routine of just getting up and working out and getting it done with. And so
what time do you do that at typically?
I usually get up at 5 and I work out in the morning. And if it's, I would love to go. I sometimes go outside, sometimes on the weekends or days that I don't have to get up as early, I can go outside and run, or I do some, strength training, or I have a bunch of different workouts that I do in the morning. And my favorite breakfast, I would have to say, is an omelet with mushrooms and spinach. I don't eat dairy, so I don't eat cheese with it. And I might have, kiwi or berries with it as well. That's my favorite. That's my favorite breakfast.
Yeah.
I love, I really do pay attention to toxins, as try to lower my toxic load. I'm not the best detoxifier based on my genetic variations. I have some SNPs in that area. So I have to really make sure I'm getting enough of my cruciferous vegetables and fiber. And I do really pay attention to my toxic load. So Environmental Working Group is a great website where you can look up, personal products and make sure that there's no parabens or phthalates or these xenoestrogens we were talking about, keeping the plastic low. I don't store my food in plastic. I don't drink out of plastic. And even if a water bottle says it's BPA free, if it's plastic, I'm like, oh, that's some other plastic.
Glass, everything.
Yeah, exactly. Glass is the way to go. Maybe a little stainless steel here and there. So, and I really try to incorporate, as I said, some relaxation exercises for myself during the day and definitely in the evening.
So. And who do you get your group support from?
So, my kids are amazing. My son's still living at home, but my daughter was just home for a week or so over Thanksgiving, which was wonderful. My husband is my rock. He always reminds me to stop and rest and take more time for myself, which is amazing. And he's an amazing cook. And my parents, I get to talk to my parents all the time too. And I have some great, great friends, and my parents are great support as well. So.
Nice. Well, I love that you are not only just an example, but everything that you've been through, that you you didn't just use it just for you. You are incorporating it into your practice, to your patients, and even to those of us who are not your patients and are able to learn from far away. And for those people who may not be close enough to the Ultra Wellness Center to see you, are you doing Zoom type of, house calls? Can somebody go online and sign up to be a patient of yours?
Yeah, so I'm at the Ultra Wellness Center in Lenox, Massachusetts, and through that website you can find out more about the different things we're offering. And yes, we are doing some telemedicine now. Well, we've always done telemedicine, but we're even doing initial appointments telemedicine now because of COVID-19. So that has allowed more people the flexibility of working with us.
That's awesome. And for those of you out there, if you want to keep up with Dr. Boham, you can go to her Instagram, and I believe it's at Dr. Boham. Is that correct?
That's at Dr. Boham's Twitter, but my Instagram is Elizabeth Boham, MD.
Oh, okay. Got it.
Facebook. Yeah.
And then if you want to download your PDF, you can go to your website, which is drboham.com.
Exactly.
If you want to also buy the DVD, you could do it there, or you could do the Vimeo link, correct?
Absolutely. But Fallon, it's been so great being with you today. This has been a fun conversation, and it's really great to get to be with you and your viewers.
Thank you. This was amazing. I know I asked tons of questions, but I hope too that some of my viewers will benefit from this and seek out help from you if they need it. Everybody else watching, thank you for tuning in. You guys can find me at Fit with Fallon on Instagram or fitwithfallon.com, and we will see you next week for another great podcast. Take care.